Okay, I'm now going to interview with the Timbalan Dekan of FTK, Dr. Rohani. Okay, good afternoon, Dr. Rohani.
Yeah.
So I'm going to ask you some question. So the first question, how often doctor will looking for help from our staff from UTHM?
How often? Usually, we always check their attendance. Okay, when they come in, they slide. So that is a system where recorded by the registrar, and then from the registrar feedback every month, and in fact the staff itself knows that whether they are late coming to work or whether they are off. Okay, so we know, and the staff itself knows.
Okay.
So when they have some problem regarding the late comers or they didn't come, so we will call for the staff and or to fill in a form, so to what to say, to give reason why they are late or why they are off today and so on.
Okay, so this is the way to maintain their.
Yeah.
Okay, and
to coordinate lah, so to monitor. That's the system. That's the system.
Okay, so from our survey during before this, we did a survey form, and the survey form is subjected to the students in UTHM. So most most of the students say that the apartment of UTHM, the staff will like, okay, if you ask for this proposal, then they will leave your proposal here, and they will take many days to settle the proposal, and this situation, should it be a normal situation, or this criteria is a bad performance by our staff?
Actually, it's a bad performance for our staff. We know that the staff didn't understand actually what their what to say, their job and responsible. Actually, they didn't really understand about their responsible, their what to say, their behavior that affect all the organization.
Okay, so this is also related to the things that the situation that the apartment kick you to this apartment to another and ask you to do this to this apartment, then from another apartment. So the thing will be go very long way. And the other problem is some of the students, their feedback like, okay, the staff will actually, the lunch time for the staff will be 1 to 2. So about 12:50 they will close the counter already, and if you go to the counter at 2, the staff will not be there. You have to go around like 3 or 2:50 something, only the staff will be there. So is this a criteria like we didn't train them well, or the booking performance is just like this in Malaysia or in UTHM?
No, actually, the first important thing is the attitude of the staff. Okay, right? But when dealing with staff, I think the best way is the student itself knows how is the procedure, right? So I think if I can suggest for the student, you have to pick the best way how to deal with them. So what I mean is, for example, if you are dealing with some staff at the administration side, you have to make a phone call or make a, what to say, appointment, so that the staff is there. So because that is time consuming, right? So I think maybe that's the way. That's another alternative lah. But then we also, what to say, relate link with time just now that you mentioned. Okay, so actually that time also is what to say, to make you understand your job scope and what the time you should be in the office. So that relate with the staff attitude and behavior lah.
Okay.
So they know that they are giving services, so they should know. Okay.
Okay. So last question. Any recommendation doctor can give to the staff or give to the students before beside the one you said just now?
So that is one point lah. If you are dealing with the government or the staff organization on this DTHM, it's better for you to make a dealing or an appointment with them first,
Okay.
so that your work will go smoothly and what to say, thoroughly be done.
Proceed with a better step lah.
Yeah, right. So
Okay.
proceed with a better step.
So I think that's all for the
Right,
interview.
okay,
Thank you.
Bye.
Thank you,
Right,
doctor.
right. Okay.